characteristic meaning say what in Asamoah. Now say what comes to mind?
Yes, and see, you say a few weeks ago, graphic posted publishes statistics, no, and it's very true.
Okay.
And because of that, we've been making a lot of advocacy because cardiovascular disease is the leading cause of death in Ghana.
Say. Akuma yari ani ne keka ka ho no.
Yes.
Eno na Ghana anyina ne kunye number 1.
Yes, cardiovascular diseases, no.
Wow.
Now, so when you have cardiovascular disease, not say you survive, still you have certain degrees of limitation in terms of how you can function. Because so being a BBC heart failure, that means the heart is weak, more or less. So, ahwadena akumano edible for you to get enough blood to do your activities has reduced. So that generally means your energy levels will be lower. Obinia stroke, then a part of the body tends to become weaker.
Yeah.
So your mobility is also challenged. And see, even if you survive, there will certain lasting effects ever affect you in your day-to-day activities.
And high BP, cardiovascular diseases, stroke, yamfani mako. And the high BP eba, especially in men.
In high BP and Kasano, there were 2 types.
Okay.
There were different primary and a different secondary. Secondary, and then I able to me say this caused it and that caused it. In Tabia, you have thyroid disease and a kidney disease and some other issue that brings it up. Primary DNA, which accounts for 90 to 95% of those with hypertension or high BP, you to pinpoint the exact cause. Usually, age-related. As you age, or arteries, they become stiffer, and that tends to increase your risk of having hypertension. Yeah. But in addition, there are certain risk factors that are contributing, and also you 2 types: modifiable and non-modifiable. Non-modifiable, so age above 50 is one of the non-modifiable ones. Male gender, the fact that we are male, say your risk is higher.
And I will tell me that okay, so be number 1, what can no mommy in the kind? When you fear you no more air corner, also who say a baby I would no and sha.
Yes,
and to me and ya.
Yes.
Now, what say a bear man so dear? And not just a no cry a constant say, beer, chiremu yeni entiasi.
Into the exact cause, papa, but what I can say is say, usually for ladies, especially premenopausal ladies, hormones na your bar there was some protective effects against cardiovascular diseases. In the mere fact say we your bar with those hormones in your reproductive years, you have some benefit. But the more we and then as you go into menopause, then protective advantage is reduced, and it's almost the same risk as men.
I didn't think I was a member or they would take kapa banasa. Is it because they are men do musisa position?
Yes, so again, because hormones na men don't have it in that same amount. In sa protection, the men don't tend to have it. Aside that, so we also have certain psychosocial factors. So I'm sure what to say in Krofokasa is a men's world, that kind of thing. So generally, men tend to be under much more stress, doing multiple jobs, trying to provide for families, running here and there. And some men, I know people who bear say 8 years, no one could leave that. Moko leave cry so that they can do another job somewhere else. And all this puts stress on the body, and part of the stress response between lead to stiffening of the arteries and to causing hypertension. So multiple things.
Multiple things. It be high in it be so our friend risk factors. I bet to me the I know high BP as someone can. Yamra a heart failure no.
And heart failure is an effect of high BP.
Okay.
And say will be a cause for some time. Then and also it puts a strain on akumano. And say akumano eba it's beaten against high pressure. Over time, akumano ankasa muscle ebe thicker to match that high pressure. It's a say a young man a wako gym. Also wako gym a wako mad so initially na ye den mano. But over time, no, the muscles never yet and then he was able to do it, and I'll fire another weight like that. So similarly, Akumano, so the muscle becomes bigger, but a bigger. That means that into being relaxed, papa in receiving blood to pump out.
Akumana e macho.
Yes, Akumana e macho exactly. Now we say macho for no time be a omo to me relax say. Into Akumano say macho into me relax say into time be to say. So now the amount of blood at air pump be reducing. Then the blood back flows into the lungs. Not lungs, not insio. Now I know. And so at insio. And that is what causes heart failure.
You're stroke, so.
And it's still the same hypertension. No? And the more blood flow at high pressure, no, the more it causes little injuries to the wall of the arteries. Because nyankopon boni pediano or boni say the blood will flow at a certain pressure. And once you exceed that, no, there are small damages to the arteries. Ebanisana cholesterol share sa injuries in them, and then it starts to block the artery. Into abia anka artery, no, if it was supposed to be round like this, because of cholesterol blockage, no, CCR is just the small space.
Ooh.
So you have reduced blood flow to the brain. Sometimes in the blockage, you know, as blood flows, surface no to marry. And a clot forms on it and then blocks the artery completely. So no blood goes there. Now when you're stroke, say akumana, now when you're heart attack.
Wow. Okay, nti yamfa ne Marco. Yamwa your husbands, your papa no money. How do we prevent high BP? Because as a shot, see if you hold, it's all connected.
Yes.
Senya working, not just so as we enter ahinasan enam. High BP no esha be affect akumana, be affect the blood vessels now.
Yes.
How do we prevent this?
The main thing is targeting nyameka and modifiable risk factors. No?
Okay.
Non-modifiable ones, you can't do anything. Where Bama, where the 50, where the 50. If there's a history of it in your family, there's a history of it in your family. But the modifiable ones, no, physical activity. Some of us, if you fear air-conditioned car to work, sit at a table the whole day, go and eat, come and sit down, evening, sit in the car, go home. No physical activity at all. Some of us cry in offices, no, or intercom. Into pesa OBBBI, you don't even have to get up and go. You just pick the phone and call. So physical activity is very important. I say it to me, yeah, more active so that we can help to protect ourselves. I think so in diet, no, nutrition is not handsome. It's important to say we eat more fruits and vegetables, more grains, and things like sweets and meat. We reduce the intake.
Sweets, no, in person because one time we'll be invited me to MC. Not me who said, "Mama, penny for." A beer no sodas like being person about brandy beer day, and I was asking myself, hey. Say.
Yes, intinina increase risk, no?
Yeah, in that, let's dwell there a little. Let's come to the liquors and the spirits and the beers and on all of that. Because you say, and some people, so it's me, my BP because no cressa.
Yes, I know, correct. And sano, what happens, they say, as the body is breaking it down, no? Some of the byproducts are toxic to the body.
Okay.
And I know that it may cause problems. No, I think so. Sawonum in Sabibria, it affects Unipediano ability to absorb certain vitamins. Ebeboa Nipediano with senior a processing yama. And once you lack these vitamins, you know, then that increases your risk.
Okay.
Aside that, you know, the sugary things and our sweet things, you'll be a friend of calories. And see, so I can't say calories are what it means basically. And they say, would it energy be free in what you don't use, you know, it tends to store it as fat.
Yeah.
Usually in the abdominal area. And see, that is what will lead to pot belly and that kind of thing. Now, so abdominal fat, you know, say it also affects your ability to metabolize things like sugar. And see, that also increases your risk of having things like hypertension and diabetes.
Wow.
And then also increases your risk of having high cholesterol. And then together, no, they cause issues. So on the screen, you see, no, we have it's a pyramid.
Okay.
There's a type of diet called the Mediterranean diet. In terms of a form hono, be physically active and enjoy meals with others. In terms of be more side, be more ball, be more call walk.
Yes, yes. So
Yes, and see, so
dancing in church. Let's be dancing in church.
Yes, dancing in church, dancing at parties,
yes,
dancing in your home.
Yes,
because all this is physical activity.
Okay.
Yes, and then it's aside the fact say it keeps you physically active. It helps deal with the stress.
Okay. Yeah.
Then
because you mentioned stress.
Yes.
As one of the factors, especially for men.
Exactly.
Okay.
Now the next step of the pyramid, fruits and vegetables and grains. In terms say there's whole grain bread.
Yeah.
There are vegetables, carrots. There's olive oil. When it comes to protein, seafood is the preferred option. And see, we have fish and seafood there. Then above that, poultry and eggs. And I want to say at the top, the smallest part of the pyramid, meat and sweets. So that should be the least. But I will say, normally, say mema ye kodi fufu a, yempese be hu fufu no. Fufu enquire the nam akata bibia so hu fufu no crapo. That habit is not the best because all that meat increases your risk of.
Your body does not need all that.
It doesn't need all that.
Doctor B can say me, Doctor Kokrebi, also yes, Anna, catch her on me poison me. Me, say, fuka can then namun cause it, namun to different. Also, your body does not need that.
It doesn't need
or can be saying, Bema cry when you need from 50 now, kind. Also, be here and say matches box.
Actually, right from because processes when you know they start from teenage years going up.
And profrimu. What did you when you did from now we are mebunun kakra na fe obedru ho no na enu aboa no with the age factor and the stress na kofa we nyina
enti enye say it's starting from the age of 30 or 40 it started from in collaboration.
Hence the importance of inculcating a healthy eating in the children.
Yes, very important.
Na omu nyini nche.
Yes,
wantu nka say mo friend o metumi edi bibia na me amaye penina. It was said me share me did mu.
Yes, because when we say in the world, the highest life expectancy is in the Far East, Japan side, and they eat a whole lot of fish. It's mostly fish that they feed on, and these are parts of some of the reasons why was a high life expectancy.
Wow. Okay, so what can so wait, does this pertain to the stroke, the heart failure and all of that, or when it comes to the heart failure, you have specific and no one be opposite with church?
No, so it's generally the same. And see, say cardiovascular diseases are, and yet adebako, heart attack, heart failure, stroke, clots in the legs, and tinina together cardiovascular diseases. And are your risk factors for cardiovascular diseases? To say hypertension, diabetes, high cholesterol. And see, risk factors, it to me cause any of these cardiovascular diseases. Wow. It can be one, it can be multiple. Kidney disease and so a complication of risk factors and also.
Not just say one share BP no any wakuma hunsemu ya nyesabi akoma nko na betumi aka no betumi aka wadwene ubo kidney betumi aka kidney ni ade
betumi aka
weni is it diabetic retinopathy as a
yes. Diabetic retinopathy, hypertensive retinopathy
nina betumi affect weni we e be ma onu anu mema hwefra no pa ya ye dede pa intimi gidi se ne mema e hwe any one kasa from a doctor's point of view nia wo betumi aya because who kohun so obi enya stroke at a very young age. It's a very pathetic sight. Tell you how or you're weak and all of that. Before you even come to what you tell them, let's talk about say niaba hard drugs. When its effect on our BP, on the heart, and on the brain.
And see that's a very important point. And see some of the hard drugs, most notably cocaine, and also to me contributed to high BP because what they do is that a artery is near narrow. And over time, it contributes to having BP, can increase risk of heart attack and stroke. There are other ones, to say marijuana, niade. Now those ones, directly, they may not affect the blood vessels, but or more effect on the brain. And they affect the way the brain processes things. And that's too bit to me contributing. And hard drugs, in fact, even aphrodisiacs Mema no, some of us, your yere, your other people. Time they are, will be already 65, which is your baby already 25. In Tokofa for these are being in your all these things bit me are contributed to increase that risk because me now at the stress at all. Akomane so.
And I don't need to come for tramadol, ni codeine, ni sa, ni na hard drugs ni bi anase no those painkiller and for abusing nowadays. Na no so bet me nya sa insunsanso no.
It depended. The question is, are you taking it based on a prescription?
Okay. And
I say you are taking it on your own. So, prescribed there, a trust said dose no air controlled for a particular reason for a particular time. And no, that would also mean say, maybe a review. So all those things will be monitored. But say, idea one, walk off our there, then you are taking it on your own there, then that increases your risk.
Right. So what do you have to tell your brothers and sisters?
So what I'll say is that say you're boy and home buying because whatever it is, no, our families need us. And say you increase your physical activity, you to me exercise. In addition, I say you did this habit of eating excess amounts of meat, no, and more into say you did. Then in China, I want a so I say it so. Into on the screen, you see, I know say there are different types of activities at Eboa. Into we say obi bot tennis, obi nante, not walking slowly, but just brisk walking. So obi to me a jog and so obi to me a run, to America, obi to me. But if not, no, at least walking alone is fine. Obi to me asa, swimming, riding bicycle, doing gardening, nina physical activities are to me boa. And these are the kind of things that we need to take up. A woman said nowadays, because of our work schedules and the rest, you know, we may find it difficult to find time. But yeah, I say some activity is better than no activity at all.
Absolutely.
And even if won't mean dedicate a certain amount of time to it, recommendation there say you should do 30 minutes of exercise 5 times a week. Wow. So if you're not based on your schedule, won't to me, do what you can. Some activity will still give you some benefit. I think so. Handle your stress. Yeah, remember, a lot of us have a bear kind of attitude, bearman kasa kind of attitude. So we can't with problems, you're less of a man.
Yes. You are weak.
But that's not true. You are doing that to protect your mental health because in medicine, you'll be very friend of mind over matter.
Yeah.
So what drain or what's going on in your head can go a long way to control what goes on in your whole body. And someone protect your mental health. And interestingly, this month, Mental Health Awareness Month. And it is Hypertension Awareness Month, coincidentally.
Yeah.
If you're not able to protect your mental health, you just increase your risk of all these cardiovascular diseases. And in the end, you say, had I known? Had I known? By that time, your wife now has to stop work to come and take care of you in the house because of stroke now when you're so you wear a diaper. Now you're a change your diaper. Won't call and every time they are sending money, then they get tired and a whole lot of things. So just prevent it. Be more active. Take charge of your health.
Take charge of your health. Let's talk about sleep. Because in my research, I was very surprised that sleep actually contributes significantly to the high BP thing and by extension, the rest of everything that comes with it. Let's talk about the benefits of sleep, especially for our daddies.
Sleep, the benefits of sleep can never be overemphasized.
Wow.
Sleep is when, as you go about, there's, based on there's some degree of damage going on. And so
wear and tear.
Yes, wear and tear, exactly, exactly. And Senia, what do car cost servicing? No, sleep is your servicing.
But you can be also.
Senia, what do car cost servicing? For them to change the oil and check this and check that. Sana sleep air nipediano servicing. Now, nipediano, there are your nervous system, no. There are 2 main types of controlling body functions, no. Back air sympathetic, back air parasympathetic. Parasympathetic, no, that's what makes you rest. That is what helps you to heal from all things. That's what helps you to handle stress. Sympathetic, no, bepententem, there's action, fight or flight. So I'm always on the move. That is sympathetic. And see, the less you sleep, the more you're sympathetic. So the more you are on edge, the more you are ready to fight, the more you are ready to flee, you are active. Parasympathetic, okay, let's cool down, let's relax, let's rejuvenate. And see, sleep is very, very important. You probably they sleep 3 hours, 4 hours, and they are up and about. They even need coffee to stay awake. All that is not
coffee.
beneficial.
Energy drinks,
Yes.
And it has a direct correlation to high BP. No, I was very surprised. Energy drink, no.
Yes, very, very direct. And see, it is important to sleep. Recommendation, no, 8 hours, but at least try and get 6 hours of sleep.
Daily?
Daily, yes, daily. If people saw when they sleep, they are not really asleep. They are sleeping, but they are thinking. And see, even though they are sleeping, the quality of sleep is not good. Obi da na also ejuma ho da ye say okutia obi kana somebody owes the pet. All you need to have good quality sleep.
But how do I relax in the face of all that? Because my man said me buy yari the hospital, be me mama papa yari otina fear to me. You know those things.
It's true.
How do I sleep when I have all that on my shoulder?
Yes, it's true. The reality on the ground is that there are some things that we find difficulty controlling. But if you have all those things going on, that's why there are people to talk to. Don't bottle it all up.
So I like the premise you began this whole thing. Yes. Let it out.
Yes, let it out.
And let's go back to the sleep. We say at least when you cry, 6 hours, 8 hours. But when you cry 6 hours, Obeka to me they mean to me now, but me relaxing. Can relaxation, watching a movie, reading a book, and all of that can it be substituted for sleep?
No, it can't. It can help with stress management, but it's not a substitute for sleep. Because your body is still active in one way or the other. When you sleep, your body, in a sense, shuts down. It's as if you're using a laptop, and your laptop is asleep. So similarly, you also have to have time that you are sleeping. The rest is beneficial. It helps to take your mind off the stresses of work and stresses of say. So you're able to relax a bit, but it is not the same as when you are completely asleep for your body to fully
repair.
Yes, to fully repair.
Wow. I was here for Dr. Kofi Takyi Asamoah. Edin komo afa akumayari a ehun semu aba se eyi nipa ewu wo Ghana nyina no ohamu nchichemu eduesia mema na ade eku won kese pa no ene akumayari mojamroso ene stroke na ye doctor di hu nkomo na sem bi o kan ye o say we ye be ma nko ade te say ugina be bi a se wa anya hwe yi a the fact say we be ma no cry do to me gina ho nti aka ahwe o ka say we di from 50 mfi aduonu mu nso kwa say we oba o we be ma hu hia say we be hwe hu yi o san ka say ye didie mu say na esi didi anhwe yi a ene ensanom ene enumoni a ebinom o se eduro no say painkiller na o nom a doctor na atro ama o so bi afa de ba kunde bia na ba kwa no pa na say nyumre doctor numu o se ye no e controlled enti enya nsunsuanso boni bia wo so o san e ka say ye na o se enna se nke ye beda nke beboa ye pa bi say doctor say doctor o ha wo mu o stress wo mu o se bomodin anada ye be wunti ye na I was here for move to me aba be ka ye ho na at the right time ye the phone lines no be good screen nani na wa frɛ wo asɛm bi obebusa doctor na wabusa no if you so free here me nya doctor mean to me well doctor apart from me abobo so nyina no bibin so edawakoma so you are there with the patient and all of that tell us about your experience na Ghana for there said I thought that you fa ye ni ehun ya ye nyini wona one patients ne wo ho talk to us about the experience of dealing with people with high BP, stroke, any heart failure at this normal.
And see, in terms of the experience, the first thing they said, we have a lot of people almost starting journal, they stop it. Omujai. But you see, treating babies with hypertension, diabetes, high cholesterol, heart failure, no, a lifelong treatment. And yes, sir,
Ubeno what's this idea and say, Enya Bauswa?
Wofa in Drono Afebo, Kepem time I ride the befro. Enti Fanessa will be already 25. And when you say hypertension, well, first, no, not hypertension, no, a more winning 50, 60, 70,
okay, so it comes with age.
Yes. But you see, and we have 25-year-olds, 22-year-olds, 28-year-olds who are getting it. And it is all 28 not how start. Yeah, that means you are taking medication from age 28 till your maker calls you. And it can get tiring because anopebia, you feel like you have to take medicine. But the thing is, if you look at the effects of not taking the medicines, it is much better to take them and preserve yourself for your family and your loved ones. And Crawford Bebre, they start taking it and they stop because they are concerned. They go and read somewhere, say, we don't BP draw where we kidney best say, we liver best say, and we bear my bay week.
Any and home come on. BP Bruno. Yes, Sabi, a cum, ye kunum, any papa no bema, and to me, you might be ufa drew baby. What's the fact?
So there are certain BP medications I know they any side effects no. Say to me causes sexual weakness. I know they name. Say some of them the side effects no is that there are some who don't develop those side effects, and there are some who develop those side effects. Those that cause those side effects no usually they are not your first line choice. And if it gets to the point where we need to give it. A Yauba reviewer, you need to let us know, say, me started fan me who say, Sisi I'm into me. Then we see, looking at your situation, are we safe stopping it and putting you on something else? And I said, do we put you on something to support?
See, the doctor, it's a matter of preserving your life and preserving your sexual vitality.
Yes. So the question is, do you want to live or do you want to die as a gallant soldier? Because yes, it's the reality on the ground. Because the other thing they say, wunya, that's the one controller. That in itself can also go and cause the weakness.
Okay.
So then there's that issue too. In Robia, it was side effects, and yenimsa side effects. No, some of them the side effects they say it may affect the kidney. No, and no dear, nobody will deny it. Which is another reason why you need to be coming for review, because over reviewer we check your kidney function, we check your liver function, we check your cholesterol, we check your sugar, we check a whole lot of things. In Swoba, Nase, we see that okay, it has dropped from this part to that, from this level to that level, and it is within acceptable limits. Then we keep observing.
Okay.
If we think it has dropped excessively, then we take a decision. Do we reduce the dose, and also we stop and put you on another one? But if you stop it on your own, without
or you don't come,
or you don't come,
pharmacy, no at all.
Yes, you don't come. We don't say sometimes you may start. You have to say BPA 150/90. You start on a droby, and you take it. So every day you go to the pharmacy to refill without going to hospital. Sometimes your BP can still be climbing up, and I said sometimes it's still at the 150/90, which is not well controlled.
Yeah.
So you are still at risk of these heart failure, stroke effects, which is why you need to be going for review so that we can check. And then in our review, saying who said will develop side effects now, then we decide with you how we are going to deal with it. And see, the decision is not, you don't decide unilaterally say menumbium, because that can be very detrimental to your health.
Wow. Abusian for 058462088 058462088. Ubetimi afre wo question bi abebusa doctor. Wo asembusa bi wo adwenkyere bi wo mu wo obi a man say wo da BP adru so ubetimi doctor share experience. Wo ka ho na dwumade ye ya ewie peye. One me ka ho anye de. Enti fresisi ya na ye ni doctor eni nkomo. One of the things I chanced upon whilst researching about this is hydration. Say, you see, at the content time, remember the brain pains you know. Yes, nipa bebre na pensuo no. Se yen ka se wo hydrate wo num nsuo eno emwa be na betumi di aboa onipadua no.
Enti nipadua no hia moja a ede be yen dwumani na. Moja eye ensio and cells. Now, as you go about, no, we want to feel free wardrobe, so your ensure component of moja no, a sort. Into a cell ensure to hydrate and replenish what you are losing. The recommendation, no, assuming you are perfectly healthy, is a minimum of 3 liters. They sell in a day. Say sachet, I trust 6 sachets of water. Say bottled water, can see, and I trust 2 minimum of 2 of the big bottle. But a lot of times, no, say you go through activities now, we tend to forget. But it's very important, say, because say one normal, it increases your risk of developing BPFN stones. So most commonly kidney stones, because say insuno nose, then it allows calcium to come together and then form such stones. You know. Aside that, say we are dehydrated, there's less blood going to the kidneys, which can cause kidney damage and then lead to issues.
Okay. So Lucy, Ufrefi Ashaman, also a question, Emma doctor, me pato find out.
Pacho, me person maybe say doctor said, me crew blood pressure, high blood pressure, or tidy meat, and no munsa. Oka bia on te, make on person or so once a while about, I mean, meet so tired, yes, I am a pa. And then person me who is to start as a vanish.
Okay, yeah, that's it. I'm saying welcome back for her benefit. Yes, I'm boss with you.
Yes, and see, Seneca earlier on, no, excess meat and alcohol, and yet, and manipediano. Whether you have hypertension or diabetes and a stroke and a BB, anything, and yet, so if you have it, no, that gives it an extra risk. And see, it is important to say, obe reduce senya odi meat no na senya onomensano, because in the long run no it bet me affect senya the BP no air control. Now it may increasing the overall risk and quality of life.
Ade back nso a me hu ye no any the indiscriminate use of herbal preparations. Yen ne no so nkomo kakra na yenka mo experience on the field. Yenka say herbs nye mpacho. But then indiscriminate use, here use no biara, no measurement and all of that. I understand say no so emasa a stroke ni no meba pa.
Yes, and this is a very, very, very important point. And as you said, no, we are not against herbal medication. No. Now, your herbal alternatives are omako through scientific study. Yenim say this amount of this is in this herbal preparation. Into sawofa, yenim nyawofa, yenim amount of wofa, yenim ne side effects no. Baby oha, omo you board a bus. Utu kwanya ko Kumasi anasunyane obi aboard the bus. Me we draw away. Say. Now what? Now akonom. Obi better gallon. Obi better bottle. Now akonom. Now these ones, no, you don't know what is in them. In fact, we have found that sometimes it may be herbal, but omode orthodox medication account. Into for example, you find say just hypothetically, neem tree, we boiling neem tree leaf, no. Now wakoto diabetes a draw. Wakoto hypertension a draw. Now wanyam. Now they go herbal way in them. Now beton. So you take it, you have no idea what you are taking. You have no idea how much of it that you are taking. And so no, it will bring your BP down all right. But because we don't know what you are taking, your BP can drop so low, so many side effects because we don't know the exact amount. Baby Oha, they come with liver failure and kidney failure because a lot of these things, liver and kidney, and now we liver no a failure, liver na yabakope. A failure, you will have to transplant. Ghana, we don't transplant livers into enoyasem. Kidney, no, that one, sisia kidney transplant, it's building up in Ghana. But until you have the transplant, no, second in this say, it's all called dialysis.
Aye.
Dialysis, no, we are looking at not less than 500 cedis per session. And you need at least 2 to 3 sessions every week. You have to say we have 2 sessions a week. 500 per session means 1,000 cedis a week. 4 weeks, so that's 4,000 cedis a month. How much is your salary? How much are you spending on rent, or foodstuffs, on call school fees, or parents? Would they 4,000 cedis a month dialysis cost?
Yeah, Getty of Refi Choco. Getty, good morning.
Hello.
Getty, Doctor Waha, Bisa Wasem.
But I'm Bisa Doctor Sembi Kakra.
Okay.
Hello.
Getty, me pato eto unka kasawai.
Me pato doctor, me serewo, me mami yare. Ena onum nso a nyum sa na kuma ebo se onum nso a na kuma ebo pre na mpese mbisa se enu so de na edi sa ayi ni ba.
Getty, offer na chomo mi odogba. Okay? Ka fie enu ice water.
No ice water.
Nika ka enu ice water ha ni etwicha. Okay.
Na etwicha. Ka enu ice water won etwicha.
Getty nu ishie. Offer no mami BP
Dabi.
Diabetes ye.
Dabi.
Okay. Mami farmer doctor. Me ba cho so what wasu. Oh, get you alright don.
Yo.
Enti to mean tre at the frontier onom
Cold water
na unya sade. I know say that some people omonum they prefer warm water because omonum cold water it has various effects on them. But what I'll say is Faneko Hospital. Na omon take full history, omon examine share. It could be said bibi wo ha winnim. If there's nothing there, then they can reassure you. Into recommendation now, my man say Faneko Hospital na doctor Nsheno to give you a full assessment. Then see say you bit me who Saint Crona onya sadiana.
Sa herbal preparation na Dr. B can me ready say etoda omobania ye diagnose omo a they are in denial, and sometimes apart from that these herbal people no man ko fa herbal na sa abon na complicated issue like you are saying afei edru baby a as a seminal agin semuna and sana omo sign at the Nipanaba hospital, and it isn't just about cardiovascular related issues, it's also about breast cancer and other issues. So what's the advice for those watching Max TV and Opec?
Yes, my advice would be if you have an issue, go to the hospital, have it checked. Say, if you don't like what you are hearing, you can get a second opinion. It's your right to have a second opinion. The doctor you see can help you arrange it, or you can just go to another hospital to arrange and have a second opinion, rather than taking matters into your own hands and then going. Because in the end, whether people go for herbal things, homeopathic things, they spend so much money. In the end, they come back. And at that point, there's very little that you bet me.
But Kolebu say more herbal medicine pharmacy. Anamebwa muni bibisa.
There be any herbal medicine.
Yeah, Lucy from Ashiaman. Lucy, good morning.
Good morning.
Doctor Waha.
Bachiru. Person maybe Doctor Assembly Kakra, Passion Kakra.
Okay.
Pacho, Mrs. Tawafa, Cecilia, over 8 months, and our BP so. But I have open Kusayachi, anybody interested. And also, I'm not being a money, I'm not say, a more being like, I did a wine so cheap. A baby man's door, and I drink sugar drinks or bed drinks. Who can be until still a non lady? And I make the first time not a quark or the first bomb, we are no preaching. She saw signing the second bomb. Still, a mommy young to stream out, and first time maybe some doctor said, and young sister should be out as well. And to what about first time maybe some doctor now on us go at TV or on their post.
All right, Lucy, that's it.
Enti onoaka semno. Enti sad dietary habits they are not healthy. Very oily foods, sugary things, and you're healthy.
In pregnancy, what are the risks this lady faces? So when Jai say, your friend says CS back home, meaning if it was related to me BP media, but also to say with this pregnancy, 8 months or BP. And now, cause you are also brother, you twisted.
And so say you're toasty.
Any those things, any such
Yes.
sugary, you know. What is this lady risking?
So first of all, the first risk is poor BP control.
Yeah.
And if the BP is poorly controlled, no, it increases her risk of baby friend pre-eclampsia.
Yeah.
And I say eclampsia. It may affect the amount of blood flow ebeko baby no ho, and that can result in having a small baby. Then following delivery, no, it depends into hypertension. No, sometimes in pregnancy, it occurs in pregnancy and after pregnancy resolves.
Yeah.
If you want so it persists, this increases the risk of persisting after delivery.
Okay.
So yes, that risk is there. Aside that, risk of other things, diabetes, high cholesterol, etc.
All right. Olivia Ufrefi Achimda, good morning.
Morning, Miss Rafi Achama, Yachimda.
Okay. All right.
What to say?
Onyanko pandom ye hu ye pa Olivia na we.
Na Alice ni baby da power.
Me pa cho omo wo ho pa.
Yo, but you anya bibia, mpese mi bisa doctor say. Me see me body ye me yama go hospital. Omo ye me test I would work. I'm go mo hunshi. Eh dear no. Because na me ton ade me important me feel say dia me arrest. So because to mo hunshi, my test is
Okay.
but you sometimes I'm so dear. Your brand na dear.
Yeah, that's it. Dr. Mpacho, ocham ye onimu asem ka osi na wasum a.
Enti se wako hospitals na se wunya any feedback, the American men say try so be who specialists, because on say in medical practice you are ranks. Enti specialists no ono you be a we sua kwetri and or some other experience. Sometimes lab no a bit me normal, but say share was history near kano and our lab now we may be able to pick something else. Into Bomoniana share ada minim hospitals I was outside but at least ultimately call regional hospital bia. There's a chance say obi to me who specialist and then that person will reassess you and then see.
Yeah. Okay, doctor, you bring us so. But me gidi say opese wo dey asem ene ya kan ama ye nyina. But for the brothers, for the husbands and the daddies and the sons, for asem ba akupetu omutrim na yenko.
The American say take care of yourself, embrace your mental health and seek help if you need help. Eat well, try and exercise, cut down salt, and make a conscious effort to take charge of your health and be there for your families.
Wow. Asempetia, osi hwe hu ye, osi adwenimu how bia na how no, especially stress no. Osi hwe so ye, waka me ehunu say wo stress too much a ewo nsusanso bone ewo wakoma so wadwene ene miaka nyina nti ya brafom. Osi ye too kura na pe baby na da. Wo dey sorry a obenya solution. Dr. Kofi Takyi Asamoah Ofi Kolebu Teaching Hospital, or a specialist or science or so, affiliated with a cardio. If one I, you can't brofoni a country frafrasa. Doctor, I know where that's CP. When you put that chirimu pa fa unkwa, take your life seriously. Na unyango pone shwe nyina so enukre, but ube wu so ube nyankwa most of the time. Ya na ejina wow so ni ube di baby abeko ni ya ube ye. Also come baby na se ye bo asa. Yasa, yebo nyuma yasa pa ukwa sorry asa uko party asa once who fear asa na enemy category dancing is how I exercise me too me pe exercise for but me was some playlist bia nyumba could be between mama sorry asa so that is how I try to keep fit and ebe ya me to me enyini who me nana no any me nana kanso am we for the Tuesday's edition of the Max Morning Show has come to an end. Thank you for joining us. You can always visit our Facebook page, Max TVGH. Don't forget to like and then share and leave your comments. We'd read it at the right time for you. My name is Joy Wilson. Thank you. Do have a blessed day and make sure to join us, God willing, tomorrow for the Wednesday's edition of the Max Morning Show. You know we'll have something to do with Lawyer Yafrumpong Anoche. And I thank all who made this show possible, and especially to Doctor for joining us today. We'll see you, God willing, tomorrow. Thank you.